so not too long, some short videos, a variety of things. I'm going to talk a little bit about these videos, but before that, we'll draw a couple more winners.
And the last three numbers are 712. And the next one would be 683.
All right. So real quick, we're just going to talk a little bit about those videos. They all talked from a global perspective. Those first two videos talked about the global efforts to stop mother-to-child transmission by 2015. Although mother-to-child transmission is much less common now in the U.S., due to an emphasis on access to treatment and assistance with treatment for all pregnant women, this is still a huge issue globally, as you could see by some of those numbers of children who are still becoming infected. The third and fourth videos chronicled Selena, the woman who was in the bed for 90 days. And the idea behind that video was to show the progression of AIDS and then the after story. And it's a great example of how HIV medications can save lives, but only if people can access the medicines. When they started filming this video, they really didn't know if she was going to live those 90 days. As you heard in the second part, she wasn't walking, her immune system had almost shut down, so they just wanted to show a real-life example of what could happen. And luckily for Selena and everyone trying to make that point, the medicines were able to reverse the HIV and AIDS. And with the effective treatment, it can save people's lives. So that fifth video about the 40 cents a day goes into people not having access. It could be as little as 40 cents a day, but people still don't have access to those medicines. In many countries, it could cost 40 cents to make sure that they have the medicines that they need, but there's still that issue of access. And then that last video from the World Health Organization was to demonstrate the choice that was made 30 years ago to fight this disease. Activists took a really unpopular stance, and they rose up to fight against this virus because they felt it was a human rights issue for people living with HIV. 30 years ago, when this epidemic first began, many of you here probably weren't even alive. 30 years ago, there were no treatments. This was a fatal illness, and people like Selena died easily. 30 years ago, no one knew how it was transmitted, and there was stigma and fear around this disease. Now we have effective medicines to manage this chronic illness. We now know how to prevent the disease, but people are still getting infected. I think the skin deep scenario is a very real situation. The very first girl said she trusted her boyfriend and she didn't think she needed to use protection. And as you saw the train go along, that's what happens. People are still getting infected even though they know the ways to prevent getting infected. Although there's less stigma and fear related to HIV today, many people still live in shame. In 2010, we took some big steps here in the U.S. The first ever U.S. National HIV/AIDS strategy was created and implemented with a powerful vision. And it's so powerful that I'm going to read it and we put it up here so that you really get the sense. The United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care, free from stigma and discrimination. The goal of this strategy is to make an impact on this epidemic, to reduce the number of new infections, to increase access to care for those living with HIV, to reduce health disparities, and provide a more coordinated national response to this epidemic. These efforts are meant to get us to zero. Some of you may have grabbed stickers when you were coming in that said, "Get to zero, getting to zero," and that's part of this strategy. Getting to zero means zero new infections, zero discrimination, and zero AIDS-related deaths. In a lot of ways, the global epidemic looks very different from what we know and see in South Carolina, but some things are the same. No matter where you live or where you're from, if you have unprotected sex or share needles, you are at risk for becoming infected with HIV. Now that I've educated you a little bit, I'm going to turn it back over to Denise and Alice.
Let's give it up. For those powerful videos and also for the strategy there. And again, thank you, Monica, for reminding us all that this year marks the 30th anniversary for the first reported AIDS case, and also 29 years into the epidemic. Now we're going to look at a couple more videos and bring it on home. Right? This next segment will talk about practical skills and knowledge to help us protect ourselves and our communities.